Progress in the pandemic right now. Average new cases are at their lowest point since August. Around 70,000 people are hospitalized right now. That is actually down from 100,000 a month ago. And average daily deaths are below 2,000. CNN's Elizabeth Cohen is joining us now. These are, look, these are real numbers. A lot of people affected, but this is definitely trending in the right direction.
It is trending in the right direction, Brianna, and we don't want to get too excited. And remember when we were talking back in June, is this the beginning of the end? And then Delta came along. But let's take a look at these numbers. I think it does give some hope that things might be going better than they were before. Let's take a look at hospitalizations. When you look at this, you can just see those numbers go down so dramatically since the beginning of September. Now, when you take a look at deaths, it's not as dramatic. The decline has been very, very small, but deaths follow hospitalization. So hopefully when we're talking, several weeks from now, we'll have a death graphic that looks like that hospitalizations graphic. I mean, we're still dealing with about 2,000 people dying in the United States every day. Now, what would get this recovery to go faster? More people getting vaccinated. If we take a look at the most recent vaccination numbers, nearly 76% of Americans have had at least one shot of a COVID-19 vaccine, and about 64% are fully vaccinated. Brianna?
I do want to ask you this talk. There was talk that once the FDA approved vaccines, there'd be a spike in vaccinations, because I think we heard from so many people, Elizabeth, oh, I'm just waiting for full approval. Did that happen?
Kind of, sort of. It did not happen as dramatically as anyone would have liked. We were actually wondering what did happen with that. Pfizer got their full approval from the FDA back on August 23rd. So we asked the Department of Health and Human Services for their numbers. And they said, look, when you compare what happened to Pfizer in the days following August 23rd to Moderna, you do see a difference. So let's take a look at this. In the days following August 23rd, which was the day of full approval for Pfizer, and the 12 days after, you do see the 7-day averages of vaccinations going up about 16%. I mean, that's a nice spike. Moderna went up only 5%. And actually, it was Moderna that had been doing better in the vaccination rate increases. So there was a switch, and Pfizer started doing better. Do we know that that's because of full approval? 100%? No, but that's probably a major reason. But both of these spikes were relatively short-lived. Then the numbers for both vaccines, those rates started to go down around September 4th. So it was a modest increase after full approval and relatively short-lived. So let's take a look at what Kaiser Family Foundation polls say actually seems to matter more than full approval. What they found was that if you know someone who was ill or died from COVID, that was more likely to be like a major reason for getting a COVID-19 vaccine. The other factors that stood out in people's minds more were participating in certain activities. You want to travel, you want to go to a sporting event that requires vaccination. That was sort of a stronger reason for people wanting to get vaccinated, or seeing hospitals filling up with COVID cases. Brianna, I'm going to quote you back to you when we talked about these numbers a week or so ago. You said fear and fear of missing out. That's what makes people get vaccinated. And I think you nailed it.
Fear and FOMO. FOMO, that's what FOMO is for the folks who don't know.
Fear and FOMO.
Elizabeth Cohen, thank you so much. John?
Thanks.
Into the COVID-19 pandemic, and we are not near the end of it. 700,000 people have now died in the United States, and still tens of thousands of others battling coronavirus in the hospital. So what have we learned, and how can we make sure it doesn't happen again? I'm joined now by one man who helped guide us through this uncertain time, CNN Chief Medical Correspondent Dr. Sanjay Gupta. His new book, World War C, is out tomorrow. New book. I don't know how you found the time to write it, Sanjay. But why? What did you want to do here?
Well, we talk about this stuff on TV all the time, but, you do hours and hours of homework to be able to even speak for a few minutes about this on television. You learn so much about this. And it's been my life, really for 2 years. I mean, I've been so immersed. I think there were several things. The science of the virus, really, what does this virus do to the body? How does a respiratory virus cause isolated loss of smell? I mean, it's fascinating and important, I think. We're in a whole new era of these viruses. The vaccine, how does that work? Just the science lessons. I really wanted to teach that for posterity. But also just human behavior. I think there's been so many surprises here. How we evaluate risk, You tell somebody something is 0.5% lethal. That was interesting. People will say 1 in 200 people are going to die. Let's do everything we can to be protected. Other people will say, so I'm 99.5% good. What's the big deal? Like, how do you convey that to people? Same objective data, different subjective interpretations, or the fact that it was novel. We don't deal with novel things. Kids deal with novel things all the time. Adults, they don't. When's the last time you experienced something for the first time? But also then how do you get out of your own way to make sure you can just look at this tabula rosa and say, let me just take this for what it is and figure out the solutions. A lot of lessons there.
Yeah, I mean, how do you get out of your own way? The United States didn't. And one of the things that you talked about from the very beginning, I remember so early on, Sanjay, I'm talking like February, March, April of 2020, the United States was doing worse at this than other countries.
Yeah, I mean, I think there's always this idea that wealth is going to buy health. We'll be okay. We're the United States. We have all these resources we can throw at something. And what you find with this pandemic is that almost universally, wealthy countries did worse. Diseases like malaria, tuberculosis, they've affected third world countries more so than the really developed countries. Not so with this disease. Why? Was it because we waited for the home run hit in the form of a vaccine and we couldn't be bothered to use masks and other basic public health measures? Perhaps. Is it just that, you know, we think of the idea that we have these diseases of privilege, obesity and heart disease, things that made us more vulnerable to the disease? Could that have been a problem? These diseases set us up for worse outcomes. Those are diseases typically seen in wealthier countries. So all these things that you sort of think about made it more likely that wealthy countries were going to do poorer. One thing I found really interesting, if you look at all these pandemics, John, the country of origin of the pandemic is often the country that was the least hard hit.
Really?
Yeah. So 1918, the pandemic probably started here in the United States. It was countries further and further away from the United States that were harder hit. China, with this pandemic, not as hard hit as countries like the United States, further and further away. Why is that? Could there be a low-level circulating immunity with pre-variants, if you will, of the virus sort of circulating? It really sets up an interesting question about how we surveil for these types of diseases going forward. Right now, we just get hit. All of a sudden, we're dealing with it. But there are sort of the pre-shocks, if you will, as well.
I never thought of that. That is interesting. Getting healthier in general, Sanjay, you say is hugely important.
You know, Dr. Robert Redfield, who was the CDC director, he said, we did not show up to this battle with very good armor on. And I thought that was an interesting phrase. I made note of that. That was about a year ago we had this conversation. And then I started digging. And it is true that, you know, we heard that the number of comorbidities that you have, the higher the likelihood you were going to have a worse outcome. There were some comorbidities like obesity, chronic kidney disease, things like that, that really set you up for significant problems down the road. We know we need to get healthier, but the idea that you could so directly tie these types of diseases to a worse outcome from COVID made the issue that much more urgent. And also, you know, just even your immunity. People say, I want to do things to build up my immunity. Well, how do you do that? Get healthy, yeah, of course, but so much of your immunity actually comes from your gut, the microbiome. And this one microbiome researcher said to me, what you had for breakfast today could give a pretty good idea of how you would deal with the disease if you were infected tonight. It's that quick in terms of how your microbiome changes, how much that influences your immunity, and how likely you are to be able to combat a disease like COVID.
So I'm thinking Cheerios and 4 espressos. How am I doing?
You're doing great, John.
Okay.
You're healthy. You're
right.
fine. But you know, it is an interesting point about just what our personal obligations are for emerging pathogens going forward. These emerging pathogens are going to keep happening, but pandemics don't have to.
The book is World War C. Sanjay, we're so proud. We're so lucky that we know you and have you here to help us out through all this, and we wish you the best of luck going forward.
appreciate that.
Congratulations on this.
Thanks, John. Privilege. Thank you.